Stroke is more lethal for women than breast cancer. A fact often overlooked. Surprisingly, about 1 in every 5 women between 55 and 75 years old will experience a stroke, according to the Mayo Clinic Health System. This is influenced by various factors. High blood pressure is one of the leading causes of stroke, affecting nearly 40% of women, who may have elevated blood pressure or use medication to control it. Additionally, reproductive issues also contribute to a higher risk of stroke among women. The use of oral contraceptives, pregnancy, and postmenopausal hormone therapy are examples of this. Women who experience conditions such as preeclampsia, eclampsia, or gestational diabetes during pregnancy are also more susceptible to stroke. Another factor is women's longevity compared to men. As the risk of stroke increases with age, women, on average, face a continuous risk throughout life. In addition to these, other factors that may increase the risk of stroke include heart diseases such as arrhythmias, like atrial fibrillation, smoking, physical inactivity, and tobacco use. Because of this, recognizing a stroke is more than necessary in the pursuit of preserving women's lives, as well as in attempting to minimize the damage caused by the stroke. Now, let's discover the 7 warning signs of stroke in women. 7. Sudden weakness in the face, arm, or leg, usually affecting only one side of the body. Sudden and unilateral weakness in the face, arm, or leg is a classic sign of stroke, indicating an interruption in the blood supply to a specific area of the brain. This condition, known as hemiparesis, results in temporary or permanent loss of motor function on one side of the body. It is important to recognize this symptom quickly and seek immediate medical assistance, as early treatment can help minimize brain damage and improve recovery chances. Do not underestimate the importance of acting quickly in the face of this medical emergency, as every minute counts to preserve the patient's health and well-being. 6. Sudden mental confusion or difficulty speaking or understanding. Sudden mental confusion, difficulty articulating words, or understanding language are crucial indicators of a possible stroke in progress. These symptoms can manifest abruptly and should be treated as a medical emergency, as they may indicate significant impairment of brain functions. When observing any of these signs in yourself or someone close to you, it is essential to seek immediate medical help for a comprehensive evaluation and rapid intervention, aiming to minimize damage and maximize recovery chances. Do not hesitate to act in the face of these symptoms, as every moment counts to preserve the patient's health and well-being. 5. Vision problems in one or both eyes, such as blurred vision, double vision, or sudden loss of vision. Vision problems are potentially serious symptoms that should not be underestimated, especially when they occur suddenly. These visual changes may be an early warning sign of a developing stroke, resulting from the interruption of blood flow to the brain. Upon noticing any of these symptoms, it is crucial to seek immediate medical assistance for a comprehensive evaluation and early intervention, aiming to avoid serious complications and preserve ocular and brain health. Do not hesitate to act in the face of any changes in vision, as a quick response can make all the difference in recovery and patient prognosis. These vision problems can be indicative of a serious medical condition and require immediate attention, as they may precede a stroke. Blurred vision, double vision, or sudden loss of vision may result from temporary or permanent damage to the optic nerves due to insufficient blood supply. Therefore, it is essential not to ignore these symptoms and to seek medical help promptly to determine the underlying cause and initiate appropriate treatment. Furthermore, for those who want to know a way that definitely can support your cardiovascular health, helping you to avoid stroke and heart attack, I left exclusive content as a thank you to you who are following my channel. Access it now by clicking on the link in the first pinned comment of this video and find out how you can reduce the risk of stroke using a simple and proven method. Continuing. 4. Difficulty walking, dizziness, loss of balance, or coordination. Difficulty walking, dizziness, loss of balance, or coordination are clear signs of possible neurological complications, such as a stroke, and should be taken seriously. These symptoms may indicate an interruption in blood supply to specific areas of the brain, affecting motor function and balance. When experiencing these difficulties, it is crucial to seek immediate medical assistance for evaluation and appropriate treatment. Recognizing and responding quickly to these signs can help prevent more serious damage and facilitate the recovery process. 3. Severe headaches without apparent cause, especially if they are intense and unexplainable. Severe headaches without apparent cause, especially if they are intense and unexplainable, may be indicators of neurological concerns, such as a possible stroke. These headaches may occur due to changes in cerebral blood flow or other complications that require immediate medical attention. It is essential not to ignore these symptoms and to seek medical evaluation to determine the underlying cause and receive appropriate treatment. Recognizing the severity of unexplained headaches and acting promptly can be crucial to prevent more serious complications and ensure timely medical intervention. 2. Unexplained fatigue, which is not relieved by rest, and may be disproportionate to the physical activity performed. Unexplained fatigue, which persists even after rest and seems disproportionate to normal daily activity, may be a warning sign of underlying health problems, including possible neurological complications such as stroke. This type of persistent fatigue, disproportionate to normal daily activity, may indicate a decrease in blood flow to the brain or other changes that require urgent medical attention. It is crucial not to ignore this symptom and to seek medical evaluation to identify the underlying cause and receive appropriate treatment. Recognizing the severity of unexplained fatigue can be crucial to prevent more serious complications and ensure timely medical intervention. 1. Sudden changes in behavior or severe confusion, such as disorientation or mood swings. Sudden changes in behavior or severe confusion, such as disorientation or mood swings, are warning signs that may indicate the occurrence of a stroke. These symptoms may arise suddenly and may be noticed by those close to the affected person. Disorientation or severe confusion, for example, may manifest as difficulty recognizing familiar people or places, or even understanding the present situation. These sudden changes in behavior require immediate attention and medical evaluation, as they may indicate a serious medical condition that requires urgent medical intervention to avoid serious complications. If you identify any of these symptoms, it is crucial to immediately call your country's emergency service. In the United States, the number is 911. Some treatments need to be administered within the first 4.5 hours after a stroke, so it is essential to seek help quickly. It is understandable to feel inclined to try to minimize symptoms and postpone a trip to the hospital. However, this reaction, while common, is unwise. Delaying care for someone who has had a stroke can deprive the brain of blood, oxygen, and essential nutrients, resulting in the death of brain cells within minutes. It is vital to seek emergency medical assistance provided by professionals specialized in the diagnosis and treatment of stroke to preserve brain cells and, in more severe cases, prevent death. Given the critical nature of time in stroke cases, it is highly recommended to activate the emergency service. Trying to drive to the emergency room can be risky and is not advisable. Furthermore, I would like to reinforce the invitation to access my exclusive content in the link of the first pinned comment. There, you will have access to valuable information and practical tips to improve your cardiovascular health, contributing to the prevention of uncomfortable symptoms and promoting your vascular health. Be sure to check out this valuable resource, which can make all the difference in your quality of life and overall well-being. Comment if you have ever felt, or if you know someone who has ever felt, any of these symptoms. Like this video so that YouTube recommends it to more people who need it, and subscribe to the channel to continue receiving our videos. Thank you very much and see you soon.